to Talk to Doc. I'm Maricel Laksa Pangilinan with Dr. Oyi Balburias.
Yes, joining us now is Dr. Mikey Bengzon. He's an orthopedic surgeon at the Medical City. Welcome to the show, Doc. Good evening.
Good evening. Thank you, Oyi. Hi, Maricel.
So, Doc, you specialize in sports medicine. Exciting to, di ba?
Yes.
Tsaka tuhod yan.
Your interest.
Have you had many patients like Jens who suffered from a broken bone ligament or cartilage break?
Yes, actually, in my orthopedic practice, I see patients who suffer sports injuries, either due to fractures or those who do not have any bone injuries such as sprains or strains and contusions.
Ano, old age, no? Ganun din, di ba?
Included in them, yes, there are some who are above 50. And mostly the injuries are due to sports, falls, or vehicular accidents.
Yan, ang delikado. Doc, can you describe to us Jens' injury?
Yes, if I can make use of that model over there.
Oh, yeah.
Okay.
Yan
Jens
ang tuhod
Nuttall.
natin.
Tuhod natin. Jens Nuttall is actually the captain ball of the FEU Tamaraos. And he sustained his an injury to the meniscus, which is actually the shock absorber of the knee. Okay, when he landed and twisted his knee. So the meniscus was actually torn in front. And this prevented him from finishing the game, and he was not able to play for the rest of the season. This happened during the semifinals of last year. Subsequently, after a few days, he underwent a procedure at the Medical City, arthroscopic or minimally invasive surgery, wherein we cleaned out his meniscus, and after putting him through a rehab program, he was able to return to sports. So he's currently doing very well now. And as you know, the FEU Tamaraos are leading in the
Cleaned out, you mean, Doc?
Did you scrape it?
Scrape
Yes,
it,
we trimmed it because it was beyond repair. And with the new instruments now that have been developed for these kinds of procedure, the wounds are actually very tiny, less than 1 centimeter each.
But what made him a candidate for surgery?
It was basically the pain was severe, especially on weight bearing. And when we did the MRI, it confirmed the diagnosis of a cartilage tear, which should not be treated conservatively or medically.
How can we differentiate a traumatic fracture from a stress fracture? Like,
Yes. A traumatic fracture usually is a fracture sustained from one particular episode or event. The presentation is very obvious. The patient will complain right away of severe pain, and there might be a obvious deformity of the limb. When you look at the limb, it might be crooked or swollen, versus a stress fracture that appears over time. So stress fractures can occur in people who constantly do a repetitive activity such as long distance running or training, or it's been seen also in military trainees when they do a lot of running. And when you try to identify the area in question, it's not as obvious as an acute fracture. So you can diagnose this by doing x-rays. When you do an x-ray of a fracture, it will be very obvious as a clean break versus a stress fracture, which shows that the bone is trying to heal itself. So there are signs of healing, but the healing is incomplete.
So, as far as diagnosing it, you know the difference, but how about the treatment? Would it matter also?
Yes.
Would there be difference?
If the diagnosis is in question through an x-ray, you can always do a bone scan, which is sensitive to pick it up, or a CT or MRI. And the diagnosis for acute fractures or for stress fractures are completely different. Okay. Acute fractures need to be immobilized, casted. Okay. If the fracture is displaced, then you need to put it together, either through specialized maneuvers or surgery. And if the fracture is a stress fracture, oftentimes it is just rest that you need to do for the
Yung
patient.
rest, ice,
Considering that a lot of people, especially in our country, are into sports, like I know this is really your interest, Doc. So in fact, Medical City have partnered with FEU, it was also a medical institution, putting up a sports performance center. So what is this like, so that our televiewers would know about this center?
The joint venture between Medical City and Far Eastern University is actually the part of FEU that is based in Moraita.
Okay.
The hospital actually is a different.
Okay.
different. But the joint venture actually was to put up a Spark Sports Performance Center that is like a specialized satellite center of Medical City that caters to orthopedic and rehab conditions.
Okay.
So rehab therapy, ganyan, if
Yes, and
you're
orthopedic
injured.
problems, not necessarily from sports injuries, from common orthopedic problems. We
Okay.
also do rehab for patients there.
So aside from sports-related injuries, ano pa yung common
Orthopedic.
causes of fracture?
Yes, based on the research done by the Philippine Orthopedic Association that collected data from around 18 accredited hospitals, we saw that the most common causes of injuries and fractures are vehicular accidents and more commonly falls. Okay, falls we've seen that it occurs in two sets of populations. You can get fractures or injuries from falls, mostly in the young population, those below 50, which consist mainly of males. And then you can also see fractures in a different kind of population. If it is above 55 mainly, then they occur mainly in females, and this is due to osteoporosis.
Ay.
Okay. Then the other cause of injury, which is from vehicular accidents, we have seen consisting from those who use a lot of motorcycles. In contrast to the research done almost 10 years ago, the most commonly involved vehicle was a car.
Yes.
But in 2003 and 2007 lately, from car, the number one vehicle used now is the motorcycle.
Yes.
And I guess you have noticed the kind of motorcycle that is out are
Yes.
really the modern kinds of scooters. And the area or the bone that is mostly involved in the drivers are the legs. In
Nababangga.
Nababangga. No? In contrast to those who fall, involve the upper extremity.
Aside from the usual safety measures, how can you prevent injuries?
Well, if we're talking about falls, especially in the elderly, it's important that our home and the patient's other medical conditions are identified. In the elderly, a frequent cause of falls is poor eyesight, poor coordination, slippery floor. We like to floor wax our houses, so maybe we should do with floor wax. In the bathrooms, we should put safety handles
Sidebars,
along the
no?
walls. Yes. If the common cause is vehicular accidents and from motorcycles, then probably we need to educate our motorcycle drivers on proper road courtesy. Of course, if you drive,
Yeah.
you have experienced
Yes.
weaving of the users.
Okay. From you know already the data common causes of fracture. So, but which part of our body is more prone to fracture or based from the registry?
Yes, based on the registry, we've seen that the most common is the area of the forearm, that includes the wrist and the elbow.
Kasi gaganon ka eh.
Yes,
Parang
Nahulog
protection.
ka.
Okay.
So
Kaya
the first
igagano.
instinct for people who fall is to use their outstretched upper extremity to break the fall. Included in the upper extremity goes all the way up to the collarbone.
Aray. So it will break here.
Yes. For vehicular accidents, it's the area between the knee and the ankle or the
So,
leg,
naka-expose.
because it's exposed. And then with or without injury to the upper extremity. So when they fall, they also use their upper extremity to break their...
Pero tama yun, di ba? What will you use naman to prevent you?
Yes.
Mapahulog ka na lang.
Yes. Actually, the registry also shows that the kinds of fractures involved are multiple fractures. So in one patient, you can have more than one fracture. So
More than multiple fractures, like there are also severe forms of fractures, like wherein we call it comminuted. So how do you deal with this kind of fractures?
yes, comminuted fracture means that the number of pieces of the broken bones are more than two. So if you think of it like a jigsaw puzzle, many pieces, in layman's term, we call it durug-durug na. Okay.
Durug na buto.
And that's what we call comminution.
Okay.
The more severe type is when the bone sticks out of the skin.
Ay,
Ow.
Okay, and we call those kinds open fractures. So for open fractures, for sure, surgery is needed to prevent infection. Okay? And since we need to stabilize it, metal is either put inside or outside the skin. Okay? For comminuted closed fractures or fractures without breaks in the skin, immobilizing it temporarily in a cast might be the initial treatment. And then based on the assessment of the patient a few days later or maybe even after a few hours, the fracture needs to be stabilized also, usually with metal inside.
Nakaka-relate ka ba?
Nakaka-relate ako dahil kaka-heal ko lang ng aking frozen shoulder. Itong pinanggamit ko tungkod.
Stay tuned because Doc Mikey will answer the questions of our studio audience and by our televiewers. After this break, Talk to Doc will be right back.